Endometriosis is a common condition that women face. Some women know they have it and have symptoms, and other women don't know they have it, and the only symptom they present with is infertility. And I would say about 25% of couples with the unexplained infertility have endometriosis because it can be silent. So endometriosis is a process whereby the lining of the uterus, instead of being shed vaginally every month, which occurs for everyone, they also have additional shedding of the lining through the fallopian tubes, which can implant in the pelvis around the uterus and ovaries. And we think this actually does happen in individuals without endometriosis as well, but the difference is people with endometriosis, their bodies allow for these implanted areas to continue to grow with the women's lining, so that when they have growth during their menstrual cycle, they'll have some growth of the lining, and when they have shedding during the shedding phase of the menstrual cycle, the lining in the pelvis can bleed as well, and that can result in significant discomfort, and then inflammatory cells in the body put out signals that can cause some scar tissue, and things can start getting a little bit sticky in there, and that can lead to adhesions and scar tissue where it might make the eggs have difficulty reaching in the fallopian tubes. It also can result in destruction of the ovary, because sometimes the ovary can engulf some of these implants, and it can lead to what we call chocolate cysts, which are basically cysts that fill with blood over time, and they can reduce the number of eggs that people have. So when I see someone that has endometriosis, I tell them we need to get aggressive in their treatment, and we need to focus on higher tech options. Specifically, IVF's been great to circumvent the inflammation in the pelvis and allow us to get eggs in the ovaries while they still have the eggs that they do have, and allow me to help that woman preserve her fertility by making embryos for future use. And then the other thing about IVF is that once the eggs and sperm are outside of the body and they're fertilizing the eggs and making embryos, then those embryos never see that inflammation. They just get safely put back into the uterus where they can implant and make a healthy baby. Endometriosis is diagnosed somewhat on history, but it requires either imaging with an ultrasound where I can see endometriosis, or during surgery. It's a surgical diagnosis where I can see implants. Classically, you had to have a biopsy of one of those implants sent off to pathology to confirm it, but once you've been doing this for a very long time, you know what endometriosis looks like. And even on ultrasound, the chocolate cysts that I mentioned that are filled with blood, they typically are readily recognizable. Sometimes people can make hemorrhagic cysts, like after ovulation, the cyst can bleed into itself, and that will resolve in a menstrual cycle or two. But with endometriosis, those cysts seem to be persistent, and they tend to grow with time. The other thing is that peritoneal or pelvic endometriosis that's not in the ovaries, I can't see that on ultrasound. So people with milder disease, they may not be able to see it, or we may not be able to see that on ultrasound, but I will be able to see that during surgery. That being said, I don't take everyone to the operating room who I suspect has endometriosis because typically fertility treatments are rather successful, and if a woman is asymptomatic, we may go through IUIs, hopefully she'll get pregnant, but if not, IVF truly is the treatment of choice for people with endometriosis and will increase their chances tremendously.